The security guard's hand came up fast. "You can't be here." Dr. Olivia Brennan didn't flinch. Her fingers moved to the collar of her scrubs, pulling out a thin chain. A dog tag swung free, catching the fluorescent light. The room went silent. Not her name on the metal, someone else's. Someone whose legend every military medic knew. "Colonel David Rains," Lieutenant Carla Wade whispered, her face going pale. "Where did you get that?" Olivia's voice was quiet, steady. "He gave it to me. Kandahar, 2013, right before he died." For more stories like this, subscribe to Emergency Hero Stories. 6 hours earlier, the evening shift at Metropolitan General Hospital was winding into its rhythm, the kind of rhythm that felt almost comfortable, almost routine. Dr. Olivia Brennan adjusted her surgical mask and stepped back from the table, letting the attending surgeon take over the final closure. Gallbladder removal, standard laparoscopic procedure, nothing remarkable, except her sutures were. Dr. Richard Voss, chief of surgery, leaned over the incision site and frowned. His eyes tracked the interrupted horizontal mattress pattern she'd used on the trocar site. "What is this?" He pointed with a gloved finger, not quite touching. Olivia kept her hands clasped at her waist. Interrupted mattress sutures. They provide better tensile strength and reduce the risk of dehiscence in high-tension areas. "I can see what they are." Voss's tone carried an edge. "I'm asking why a second-year resident is using a technique I haven't seen outside of trauma journals. I study a lot of journals." Clearly, Voss straightened, pulling off his gloves with sharp snaps. "But speed matters less than consistency. You're slow. Work on that." Olivia nodded once. "Yes, sir." She stripped her gloves, tossed them in the bin, and walked out without another word. In the scrub room, Dr. Priya Mehta was washing her hands, watching through the window. She caught Olivia's eye in the mirror. "That wasn't slow," Priya said. Olivia ran water over her hands, silent. "That was precise, and I've seen that suture style before." Priya tilted her head. "Military field technique. My brother's an army medic. He showed me pictures." Olivia dried her hands tearfully, every movement controlled. "I read a lot." "You said that already." "Because it's true." Priya leaned against the counter, arms crossed. "You've been here 6 months. You don't talk about where you trained before. You don't go to happy hours. You take every shift no one else wants. And you suture like someone who's sewn up a lot more than ball bladders." Olivia pulled her hair back, tightening the bun at the base of her neck. A few strands of auburn escaped, framing a face that was hard to read. Gray-green eyes that didn't give anything away. "I'm exactly where I need to be," Olivia said. She pushed through the door and headed for the residence lounge. The hospital felt heavy that evening, not with chaos, with waiting. Olivia sat in the corner of the lounge, reviewing charts on a tablet. Around her, other residents talked, laughed, complained about Voss and his impossible standards. She didn't join in. She never did. Her watch read 5:47 p.m., 13 minutes until shift change. The pager on her hip buzzed. She glanced down. Routine consult, 3rd floor. A post-op patient with nausea. She stood, grabbed her stethoscope, and headed for the elevator. The patient was a woman in her 60s, 2 days post-hip replacement, sitting up in bed, pale, hands trembling slightly as she reached for the water cup. Olivia stepped to the bedside. "I'm Dr. Brennan. They said you're feeling nauseous?" "A little. It's not too bad." Olivia watched the woman's hands. The tremor wasn't from weakness. It was rhythmic, subtle, but there. "How long have your hands been shaking?" The woman blinked. I don't know. A while, I guess." Olivia pulled out her penlight, checked the woman's pupils, equal and reactive. She pressed 2 fingers to the woman's wrist, counting, pulse slightly elevated. "Have you felt unusually anxious, short of breath?" "Maybe a little. I thought it was just nerves from the surgery." Olivia pulled up the chart on the bedside monitor, scanned the medication list, then the pre-op labs. Thyroid function, elevated T3 and T4, noted but not flagged. She pulled out her phone, opened the calculator app, ran the numbers against the woman's weight and age, then checked the surgical notes. The anesthesiologist had used a standard protocol, but with undiagnosed hyperthyroidism, even mild, that protocol could trigger a thyroid storm within 72 hours post-op. Olivia looked up. "I'll be right back." She walked quickly to the nurse's station, paged the attending on call. Dr. Voss answered after 3 rings. "This is Brennan.
I'm on 3 with a post-op hip. I think she's at risk for thyroid storm. A pause. Then, based on what? Tremor, elevated heart rate, and pre-op labs showing subclinical hyperthyroidism. It wasn't addressed before surgery. Her vitals are stable. For now. Another pause. Longer this time. Dr. Brennan, thyroid storm doesn't present with mild tremor and slight tachycardia. If you're going to call me with a consult, make sure it's actually urgent. The line went dead. Olivia stood there, phone still pressed to her ear, staring at nothing. Priya walked past with a stack of charts, then stopped. You okay? Olivia lowered the phone. Fine. You don't look fine. I'm fine. Priya didn't move. What did Voss say? That I'm wrong. Are you? Olivia looked back toward the patient's room. The woman
was lying down now, eyes closed, resting, stable, for now. No, Olivia said quietly, I'm not wrong. She walked back to the lounge, sat down, and pulled out her tablet again. Opened a file she hadn't looked at in 2 years. A scanned photograph. Dust-covered surgical tent. 5 people in blood-stained scrubs, exhausted, leaning against each other. A man in the center, older, gray at the temples, holding up a mug of cold coffee like a toast. Colonel David Rains, her mentor, her commanding officer. The man who taught her that hesitation killed people, but so did recklessness. Observe 3 seconds before you act, he used to say. 3 seconds can save 6 lives. She had learned that the hard way. Kandahar, 2013. Olivia closed the file. Her pager buzzed again. She looked down. Mass casualty alert. All available personnel to trauma bay. Immediate. She stood, her body moving before her mind caught up. And then the building shook. Not an earthquake, an explosion. The lights flickered, alarms started screaming. Somewhere in the distance, glass shattered. Olivia ran. If you want to see what Dr. Brennan does next, subscribe to Emergency Heroes Stories. Comment below and tell us where you're watching from. Because what happens in the next few minutes will change everything. The trauma bay doors slammed open. Olivia pushed through, already pulling on gloves. The room was chaos. Nurses shouting, monitors shrieking, blood on the floor before the first gurney even arrived. Dr. Voss stood at the center, barking orders. I want to count. How many incoming? A paramedic's voice crackled over the radio. Estimate 12 critical, another 20 walking wounded. Parking structure collapsed during the diplomatic security conference. We've got military and civilian mixed. Voss turned, scanning the room. His eyes landed on Olivia. Brennan, you're on minor injuries. Lacerations, minor fractures, suture bay 2. She stopped mid-step. I can help in trauma. You're a second-year resident. Stay in your lane. Sir, if there are 12 critical. I said stay in your lane. His tone left no room for argument. Olivia's jaw tightened, but she nodded. She turned towards suture bay 2, a small partitioned area with basic supplies. The place where nothing life-threatening ever happened. Priya appeared beside her, pulling on a gown. He's an idiot. He's the chief. Still an idiot. Priya glanced toward the trauma bays, where senior residents and attendings were prepping for the wave. You should be in there. I'm exactly where I need to be. Priya gave her a long look, then shook her head, and moved toward the main floor. Olivia set up her station. Suture kit, lidocaine, gauze. She worked methodically, arranging everything in reach. Muscle memory from another life. The first patients started arriving. A man with a gash across his forearm. A woman with glass embedded in her shoulder. A teenager with a broken wrist. Olivia moved through them quickly, efficiently. Cleaned wounds, placed stitches, wrapped fractures. Her hands didn't shake. They never did. But her mind was somewhere else. She could hear the main trauma bay through the partition. Shouted commands, the high-pitched whine of monitors, the controlled panic of a team trying to save too many people at once. And then she heard something else. A radio transmission, faint but clear. Transport inbound with military personnel. Officer down, neck trauma, possible spinal involvement. Protocol, Foxtrot. Olivia's hands paused mid-suture. Protocol, Foxtrot. Military medical wing activation. Restricted access, separate jurisdiction. She finished the stitch, tied it off, and stepped toward the partition.
Through the gap, she could see the main floor. A gurney rolled past, surrounded by MPs and paramedics. A man on his back, neck brace in place, an oxygen mask over his face. Blood soaked through the gauze on his shoulder. She couldn't see his face, but she saw the portable X-ray clipped to the side of the gurney. Someone had already taken imaging in the field. Metal fragments, visible even from a distance, clustered near the cervical spine. Olivia's breath caught. She knew that pattern. Fragmentation, irregular, high velocity. The kind that didn't come from a building collapse. The kind that came from an IED. The gurney disappeared through a set of double doors, marked restricted access. 2 armed MPs took position outside. Olivia stood frozen. Her vision blurred at the edges, sound warping. The fluorescent lights too bright. Sand under her boots. Heat pressing down like a hand on her chest. The smell of burning diesel and copper. A young private on the ground, eyes wide, chest torn open, sucking wound, pulling air in the wrong direction. Her hands covered in sand and blood. Her voice steady, even though her heart was trying to break through her ribs. Stay with me. Stay with me. You're going to see your kid. You hear me? You're going to see your kid. Brennan. She blinked. Priya was standing in front of her, concern etched across her face. You okay? Olivia swallowed, forced herself to breathe. Fine. You don't look fine. You look like you've seen a ghost. I'm fine. Priya didn't push. She just watched for a moment, then nodded toward the suture bay. You've got another patient waiting. Olivia turned back, pulled on fresh gloves, and kept working. But her mind stayed on that gurney, on the fragmentation pattern, on the face she hadn't been able to see. 20 minutes later, Olivia finished suturing a scalp laceration and stepped out to grab more gauze. The main trauma floor had settled into a rhythm.
Organized chaos, the kind that meant people were surviving. She walked past the restricted wing entrance. The MPs were still there, standing rigid, hands near their sidearms. Through the small window in the door, she could see movement inside. Medical personnel in military fatigues, a surgical bay being prepped, and the gurney. The patient was still there, stable enough to wait, not stable enough to move. Olivia stopped. She shouldn't look. She shouldn't get involved. She was assigned to minor injuries. She was supposed to stay in her lane. But she looked anyway, and through the window she saw his face. Older now, harder, lines around his eyes that hadn't been there before, but the same. Sergeant First Class Marcus Tate, 22 years old when she'd met him, Fallujah, 2011, a sucking chest wound and a collapsed lung. She'd kept him alive with her hands and a chest tube made from a ballpoint pen casing until the evac bird arrived. He'd been crying, not from pain, from fear. I'm supposed to meet my kid, he'd said, breath rattling. I'm supposed to be there when she's born. You will be, Olivia had told him. You're going to hold her, I promise. She'd kept that promise. Now he was back on a gurney, fragmentation in his neck, and she was on the wrong side of a locked door. Olivia turned and walked straight to the charge nurse station. I need imaging on the military patient in the restricted wing. The nurse didn't even look up. You don't have clearance. I need to see the x-rays, not your case. I know that patient. Now the nurse looked up. Then you know he's military jurisdiction. We're holding him until their surgical team arrives. When? 90 minutes. Olivia's pulse spiked. He doesn't have 90 minutes. That's not your call. Olivia leaned forward, voice low and controlled. That fragment is against his C4 vertebra. Every minute he waits, it shifts. If it severs the cord, he's paralyzed for life or dead. The nurse stared at her. How do you know that? Because I've seen it before. Seen it where? Olivia didn't answer. She turned and walked toward Dr. Voss, who was reviewing charts near the main trauma bay. Dr. Voss. He didn't look up. If you're done with suitors, check on the post-ops. The military patient in the restricted wing. He needs surgery now. Voss finally looked at her. He's waiting for the military surgical team. He'll be dead before they get here. You can't possibly know that from a glance. I can, and I do. Voss set down his tablet, eyes narrowing. Explain. The fragmentation pattern visible on his field X-ray shows irregular metallic density clustered near the C4 vertebra. That's not structural debris. That's an explosive device.
The fragments are small enough to shift with muscle movement or blood flow. If one migrates even 2 millimeters medially, it severs his spinal cord. Voss studied her. How do you know that? Because I've seen it before. Seen it where? Olivia didn't answer. She turned and walked toward Dr. Voss, who was reviewing charts near the main trauma bay. Dr. Voss. He didn't look up. If you're done with suitors, check on the post-ops. The military patient in the restricted wing. He needs surgery now. Voss finally looked at her. He's waiting for the military surgical team. He'll be dead before they get here. You can't possibly know that from a glance. I can, and I do. Voss set down his tablet, eyes narrowing. Explain. The fragmentation pattern visible on his field X-ray shows irregular metallic density clustered near the C4 vertebra. That's not structural debris. That's an explosive device. The fragments are small enough to shift with muscle movement or blood flow. If one migrates even 2 millimeters medially, it severs his spinal cord. Voss studied her. Silent. How long have you been looking at his imaging? I haven't. I saw it on the gurney. You diagnosed spinal fragmentation migration from a passing glance at a field X-ray? Yes. Voss's expression didn't change. That's not possible. Olivia held his gaze. It is, if you've done it before. Done it where? She didn't answer. Voss stepped closer, voice dropping. Where did you train before this residency, Dr. Brennan? Olivia's hands were steady at her sides. Her face gave nothing away. Somewhere else. She turned and walked away before he could ask again, but she could feel his eyes on her back, and she knew he'd start digging. Olivia stood outside the restricted wing doors, close enough to see through the narrow window, but far enough that the MPs wouldn't tell her to move. Inside, a military physician in ACU fatigues was reviewing Marcus's chart. 2 nurses flanked the gurney, monitoring vitals. Everything looked controlled, professional. But Olivia could see what they couldn't. Marcus's left hand, lying against the thin hospital blanket, had a tremor. Barely noticeable, the kind most people would attribute to stress or pain medication. But it wasn't either. It was nerve compression. The fragment was already moving. She pulled out her phone, opened the calculator app, and ran the numbers based on what she remembered from the field X-ray. Fragment size, proximity to the spinal canal, angle of entry. If the migration continued at the current rate, he had maybe 30 minutes before permanent damage. 90 minutes until the surgical team arrived. The math didn't work. Olivia turned and walked back to the charge nurse station. I need to speak to whoever's in command of that patient. The nurse sighed without looking up. I already told you. I'm not asking for clearance. I'm asking to deliver a medical assessment to the attending physician in that room. You're a resident. I'm a doctor, and that patient is deteriorating. The nurse finally met her eyes. You really think you know better than a military trauma surgeon? I think I know what they're not seeing. The nurse studied her for a long moment, then picked up the phone. She spoke quietly, hung up, and nodded toward the restricted wing. You've got 2 minutes. Don't waste them. Olivia walked to the doors. One of the MPs stepped forward, hand raised. This is a restricted area. I have clearance to consult. 2 minutes. He glanced at his partner, who nodded. The door buzzed open. Olivia stepped inside. The military physician looked up from the chart, eyes narrowing. He was in his 40s, clean-shaven, with the kind of calm that came from years in field hospitals. His name tape read CPT Zhao.
You're the resident who diagnosed fragmentation migration from a hallway? Yes. That's impressive. Or reckless. He set the chart down. Which is it? Neither. It's experience. Zhao crossed his arms. What kind of experience does a second-year resident have with combat-related spinal trauma? Olivia didn't answer the question. She stepped closer to the gurney, eyes on Marcus. His breathing was shallow. The tremor in his left hand had spread to his fingers. He's showing early signs of nerve impingement, Olivia said. Unilateral tremor, reduced grip strength, slight ptosis in the left eyelid. The fragment is compressing the nerve root. Zhao followed her gaze, then checked Marcus's hand himself. He frowned. Vitals are stable. For now. The surgical team will be here in 70 minutes. He doesn't have 70 minutes. Zhao straightened, his tone hardening. I appreciate your concern, Dr. Brennan, but this patient is under military jurisdiction. We have protocols. Protocols won't stop that fragment from severing his spinal cord. And you think you can? Olivia met his eyes. Yes.
Zhao stared at her, silent. Then Marcus stirred. His eyes fluttered open, unfocused, pupils sluggish. He tried to lift his head, and one of the nurses gently pressed him back down. "Easy, Sergeant, stay still." Marcus's gaze drifted across the room, landing on Olivia. For a moment, he just looked at her, confused, struggling to place the face. Then his eyes widened. "Doc?" His voice was rough, barely a whisper. "Fallujah?" Olivia's breath caught. Zhao glanced between them. "You know each other?" Marcus's hand moved weakly toward Olivia, trembling. You told me I'd see my kid." Olivia stepped closer, her voice calm, steady. "You did see her. You made it home. She's 12 now." His words slurred slightly, the sedation pulling him under again. 12. I gotta see her." His eyes closed. The monitor beeped steadily, but his hand stopped trembling. Not because he was stable, because the nerve signal had been cut. Olivia looked at Zhao. "He's losing motor function. If we wait, he'll lose everything below the neck." Zhao checked the monitor, then Marcus's hand. He tried to elicit a reflex. Nothing. His jaw tightened. "The surgical team is still an hour out. Then let me operate." Zhao's head snapped toward her. "You? I've done this procedure before, multiple times." "In a residency program?" Olivia hesitated, just for a second. "No." "Then where?" She didn't answer. Zhao stepped closer, his voice dropping. "I need to know who you are before I let you anywhere near this patient." Olivia's hands were steady at her sides. Her face gave nothing away, but her eyes betrayed her. Zhao saw it. "You were military." It wasn't a question. Olivia didn't confirm it. She didn't deny it either. She just looked at Marcus, lying unconscious on the gurney, and spoke quietly. "I made him a promise. Fallujah, 2011. I told him he'd hold his daughter." She turned back to Zhao. "I don't break promises." Zhao studied her, silent, weighing something she couldn't see. Then his radio crackled. "Captain Zhao, this is command. Be advised, surgical team ETA now 90 minutes due to airspace restrictions." Zhao closed his eyes briefly, exhaling through his nose. When he opened them again, he looked at Olivia. "If I let you do this and something goes wrong, it's my career. If you don't let me do this, it's his life." Zhao stared at her for a long moment. Then he stepped aside. "Prep him." Olivia moved immediately, her body shifting into a mode she hadn't accessed in 2 years. She checked Marcus's airway, his IV lines, his neck brace. One of the nurses looked at Zhao. "Sir, are you sure about this?" "No." Zhao pulled out his phone. "But I'm out of options." Olivia turned to the scrub sink, started washing her hands. The movements were automatic, methodical. Priya appeared in the doorway, breathless. "Olivia, what are you doing?" "Saving his life." "Voss is looking for you. He's pissed." "Let him be pissed." Priya stepped inside, lowering her voice. "He's pulling your file. He's asking questions. If you do this, I'm already doing it." Priya stared at her, then glanced at Marcus. "You know him." "I do." "From where?" Olivia dried her hands, pulled on gloves. "Somewhere I don't talk about." She turned to Zhao. "I'll need a C-arm, microforceps, and real-time spinal pressure monitoring." Zhao nodded to Dasim. "Get it." Olivia stepped to the table, looking down at Marcus. His face was pale, his breathing shallow, but he was still alive. She leaned close, her voice too quiet for anyone else to hear. "I told you I'd keep my promise. I'm keeping it again." Then she straightened, pulled her surgical mask into place, and nodded to the team. "Let's go." But before the first incision, the door slammed open. Dr. Voss stood in the doorway, his face flushed with anger. "Dr. Brennan, step away from that patient." Olivia didn't move. Voss's voice rose. "That's an order." Zhao stepped forward. "With respect, Dr. Voss, this is a military case under my jurisdiction. She's my resident, and she's not qualified to perform this surgery." Olivia finally looked at him, her voice calm, cold. "Yes, I am." Voss's eyes narrowed. "Prove it." Olivia reached up, pulled the chain from beneath her scrubs, and let the dog tag fall into view. Not hers. Colonel David Rains. The room went completely silent. Zhao's eyes widened. Voss stared. And Olivia spoke, her voice steady, unflinching. I trained under Colonel Rains, U.S. Army
Medical Corps, Special Operations Surgical Team. I performed over 300 combat surgeries in 6 years. She met Voss's eyes. I'm more than qualified. Voss opened his mouth, then closed it, and stepped back. Olivia turned back to the table. Scalpel. The scalpel felt right in her hand. Not comfortable, never comfortable, but right. Olivia made the first incision along Marcus's cervical spine, her movements precise, controlled, no hesitation. The blade moved through skin and subcutaneous tissue like she'd done this yesterday instead of 2 years ago. Captain Zhao stood across from her, assisting. He'd gone quiet after she'd revealed the dog tag. Now he just watched her hands. Priya was at her side, managing retraction. She hadn't said a word since Olivia started. Behind them, Dr. Voss stood near the wall, arms crossed, face unreadable. Olivia didn't think about any of them. She thought about the fragment, the spine, the millimeters between function and paralysis. "Retractor," she said quietly. Priya handed it over. Olivia placed it, opening the field. Muscle and fascia separated cleanly. She could see the posterior elements of the cervical vertebrae now, C3, C4, C5. Suction. Zhao cleared the field. Blood welled up slowly, controlled. No major vessel damage. That was good. But the fragment was deeper than the imaging suggested. She could see it now on the live fluoroscopy monitor. A jagged piece of metal, maybe 8 millimeters long, lodged between the vertebral body and the nerve root. It had already caused compression. Another few millimeters of migration, and it would sever the nerve completely. "BP?" Olivia asked. One of the nurses checked the monitor. 110/70, heart rate 82, steady. Good, keep him there. Olivia adjusted the angle of the retractor, deepening her exposure. The fragment was wedged tight. She'd need to dissect around it carefully, create space, then extract it in one motion. No second chances. She reached for the microforceps. "Olivia?" Priya's voice was low, uncertain. "That's really close to the cord." "I know. If it slips, it won't." Olivia positioned the forceps, her hand steady. She could feel her pulse in her fingertips, slow and even. Her breathing matched it. In through the nose, out through the mouth. 3 seconds. She observed. The fragment's position, the angle of the nerve root, the trajectory she'd need to pull without dragging the metal across fragile tissue. 3 seconds. Then she moved. The forceps closed around the fragment. She applied gentle traction, testing resistance. It shifted slightly. Not much, just enough to tell her it wasn't embedded in bone. That meant she could pull it free. But it also meant it could move unpredictably. "I need you to hold pressure here," Olivia said to Zhao, indicating a spot just lateral to the extraction site. "If it bleeds, I need immediate visualization." Zhao positioned his fingers exactly where she indicated. "Ready." Olivia adjusted her grip and pulled. The fragment moved, slowly. 1 millimeter. 2. The monitor beeped steadily. 3 millimeters. The metal edge scraped against the nerve root. Marcus's left leg twitched on the table. Priya inhaled sharply. Olivia didn't react. She kept pulling, steady, controlled. 4 millimeters. 5. The fragment came free. She lifted it clear of the wound, held it up to the light. Irregular, sharp, definitely not structural debris. "IED fragmentation," Zhao said quietly. His eyes on the metal. "Russian-made, if I had to guess." Olivia set the fragment in a specimen tray, then turned her attention back to the wound. She inspected the nerve root carefully. Bruised, but intact. No visible tears. "Neurocheck," she said. One of the nurses ran a reflex test on Marcus's foot. His toes curled slightly in response. "Positive reflex," the nurse reported. Olivia exhaled, slow and controlled. "Good. Start closure." She worked quickly now, suturing the layers back together. Fascia, muscle, subcutaneous tissue. The same interrupted horizontal mattress pattern Voss had criticized hours earlier. But now, no one was criticizing. Priya watched in silence.
handing over sutures without being asked. Zhao assisted with the deeper layers, his hands moving in sync with hers. And Voss, still standing against the wall, didn't say a word. Olivia tied off the final suture and stepped back, pulling off her gloves. He's stable. Move him to recovery. I want neuro checks every 15 minutes for the first 2 hours. Zhao nodded. Understood. The team began prepping Marcus for transport. Olivia stripped off her gown, tossed it in the bin, and turned toward the door. Voss stepped into her path. My office, now. Olivia met his eyes, her face calm, unreadable. I have patience. They can wait. No, they can't. She moved past him, shouldering through the door and into the main hallway. Voss followed. Dr. Brennan, we need to talk about what just happened in there. Olivia kept walking. A patient needed surgery. I performed it. That's what happened. You operated without clearance. You revealed a military background you never disclosed. And you contradicted my direct order. Olivia stopped, turned to face him. That patient would be paralyzed right now if I'd followed your order. That's not the point. That's exactly the point. Voss stepped closer, his voice dropping. You lied on your residency application. I didn't lie. I omitted. That's the same thing. No, it's not. Voss stared at her, his jaw tight. I pulled your file. There's a 2-year gap before you started this program. No
employment record. No references. Just a medical degree and a passing score on your boards. Olivia said nothing. I called the Army Medical Corps. They won't confirm or deny your service record without a formal request, which tells me it's classified. Still nothing. What the hell did you do over there, Brennan? Olivia's expression didn't change, but something flickered in her eyes. Something cold. My job. That's not an answer. It's the only one you're getting. She turned to walk away. Voss grabbed her arm, not hard, but firm enough to stop her. I need to know who you are, he said quietly, because the person I just watched operate isn't a second-year resident. That was a trauma surgeon with years of field experience. And if you're hiding something that could put this hospital at risk... Olivia pulled her arm free, her voice calm but edged with steel. I'm not hiding anything that puts anyone at risk. I'm hiding things that are none of your business. She met his eyes. I did my job. I saved a life. If you want to punish me for that, go ahead. But don't pretend it's about hospital policy. It's about your ego. Voss's face flushed, but before he could respond, the overhead speaker crackled to life. Code Blue, restricted wing. Code Blue, restricted wing. Olivia's head snapped toward the sound. Marcus! She ran. Voss shouted after her, but she didn't stop. She burst through the restricted wing doors, past the MPs, into the recovery bay. Marcus was seizing, his whole body convulsed, monitors screaming, nurses scrambling to hold him down. Olivia shoved past them, her hands moving to his airway. Get me diazepam, 2 milligrams IV, now. One of the nurses grabbed the medication, pushed it into his line. The seizing slowed, then stopped. Marcus went limp. Olivia checked his pupils. Unequal. The left was blown. He's herniating, she said, her voice sharp. Get me a CT, now. Zhao appeared at her side, his face pale. What happened? Brain bleed. Probably delayed from the initial trauma. We missed it. How? It doesn't matter. We need to get him to neurosurgery in the next 10 minutes, or he's dead. Zhao grabbed the phone on the wall, started barking orders. Olivia stayed at Marcus's side, her hand on his wrist, checking his pulse. Steady, for now, but she could feel it weakening. Priya appeared in the doorway, breathless. Olivia, neurosurgery is backed up. There's no OR available. Olivia looked up, her mind racing. Then she turned to Zhao. The military wing has a surgical bay. It's not equipped for craniotomy. Then we improvise. Zhao stared at her. You can't be serious. Do you have a better option? He didn't answer. Olivia looked back at Marcus, her jaw set. Get him prepped. I'm going in. If you want to see how this ends, subscribe and comment below, because what happens next will leave you speechless. The surgical bay in the military wing wasn't designed for neurosurgery, but it would have to be enough. Olivia stood at the scrub sink, hands moving through the motions she'd done hundreds of times.
Soap, water, brush. Nails, fingers, palms, wrists. The rhythm steadied her breathing. Behind her, through the window, she could see the team prepping Marcus. Zhao was intubating him again. Priya was setting up monitoring equipment that wasn't meant for cranial procedures, but would have to work anyway. Dr. Voss stood in the doorway, his face a mixture of anger and something else. Fear, maybe, or recognition that he was watching something he didn't fully understand. Olivia dried her hands, pulled on a gown, snapped on gloves. When she turned toward the table, Voss stepped into her path. "This is insane," he said quietly. "You're going to perform a craniotomy in a field surgical bay with improvised equipment? Yes, you could kill him. He's already dying. This gives him a chance. A chance isn't good enough." Olivia met his eyes, her voice steady and cold. "In the field, a chance is all you ever get." She moved past him. Zhao looked up from the table as she approached. "His ICP is climbing. We're at 22 millimeters of mercury and rising." Normal intracranial pressure was below 15. Anything over 20 meant the brain was swelling, pressing against the skull, cutting off its own blood supply. If they didn't relieve the pressure soon, Marcus would suffer irreversible brain damage, or he'd die. Olivia positioned herself at the head of the table, looking down at Marcus's face. His eyes were closed, his skin pale. The ventilator hissed rhythmically, breathing for him. She placed her hand on his forehead, just for a second, a gesture no one else would understand. Then she pulled her mask up and nodded to the team. "Let's go." Priya handed her the scalpel. Olivia made the incision along Marcus's scalp, a curved line following the natural contour of her skull. Blood welled immediately. Priya suctioned, keeping the field clear. "Clamp." Priya handed it over. Olivia clamped the bleeding vessels one by one, her movements fast but controlled. Zhao watched from across the table, his role now limited to monitoring vitals and assisting when needed. He didn't question her technique, he just watched. Olivia reflected the scalp, exposing the skull beneath. Smooth, white bone. She could see the fracture line now, hairline thin, running along the temporal region. That's where the bleed was coming from. "I need a cranial drill," Olivia said. One of the nurses hesitated. "We don't have one here." Olivia didn't pause. "Then get me a high-speed orthopedic drill with a perforator bit, now." The nurse ran. Priya glanced at Olivia. "You're going to use an orthopedic drill on his skull? I've done it before." "Where?" Olivia didn't answer. The nurse returned with the drill. Olivia tested it once, the high-pitched whir filling the room. Then she positioned it against Marcus's skull, marking the site for the burr hole. "Everyone hold." The room went silent except for the ventilator and the monitors. Olivia pressed the drill bit against bone and applied steady pressure. The drill bit through, slowly. The sound was awful, grinding, high-pitched, the smell of burning bone filling the air. But Olivia's hands didn't shake. She pulled back as soon as she felt the resistance change, the bit breaking through into the subdural space. Dark blood welled up immediately, spilling out through the burr hole. "Suction," Olivia said. Priya suctioned the blood away. It kept coming, thick and clotted. Olivia placed a second burr hole, then a third, creating a triangular pattern. She used a small ronger to connect the holes, lifting away a section of skull to expose the dura beneath. The membrane was tense, bulging outward. She incised it carefully, and more blood poured out. But beneath the blood, she could see brain tissue, swollen but intact. "ICT?" Olivia asked. Zhao checked the monitor. Dropping. 18. 17. Olivia worked quickly now, evacuating the clot, inspecting the surface of the brain for active bleeding. She found the source, a small vessel torn by the initial trauma. She coagulated it, sutured it, then checked again. No more bleeding. "ICP is down to 15, Zhao reported, BP stabilizing. Olivia stepped back, pulling off her gloves. "Close the dura. I'll replace the bone flap." Priya stared at her. "You're not going to finish?" "You can handle the closure. I need to check on something." Before anyone could respond, Olivia turned and walked out. Voss followed her into the hallway. "Where are you going?" "To check on a patient." "Which patient?" Olivia stopped, turned to face him. The woman on 3, post-op hip replacement. The one you said wasn't in thyroid storm? Voss's face went pale. You think? I don't think. I know. She walked toward the elevator, Voss close behind. If you're right and I missed it, then she's in crisis right now. The elevator doors opened. They stepped inside. Voss was silent for a moment, then spoke quietly. You need to tell me who you really are. Olivia stared straight ahead at the closed doors. I'm a doctor. That's all you need to know. That's not enough. It's going to have to be. The doors opened on the 3rd floor. Olivia stepped out, moving quickly toward the patient's room. Inside, the woman was sitting up in bed, her face flushed, her hands trembling violently now. Her heart rate on the monitor read 142. Her temperature was 102.3. Olivia moved to the bedside immediately. How long has she been like this? The nurse looked up, startled. Maybe 20 minutes. I was just about to call a code. Now. This is thyroid storm. The nurse hit the button. Alarm sounded. Olivia was already pulling supplies from the crash cart. Beta blockers, cooling blankets, IV fluids. Voss stepped to her side. What do you need? Propranolol, 1 milligram IV push. Then start a cooling protocol. We need to get her temperature down fast. Voss didn't argue. He just moved, pulling the medication, prepping the line. Olivia administered the beta blocker, then placed cooling packs around the woman's neck and groin. The woman's eyes fluttered open, unfocused. What's happening? She whispered. Olivia leaned close, her voice calm. You're going to be okay. Just stay with me. The woman's hand reached out, gripping Olivia's wrist weakly. Don't leave. I'm not going anywhere. Olivia stayed at the bedside, monitoring vitals, adjusting medications, her presence steady and unshakable. Slowly, the woman's heart rate began to drop. 135, 128, 115. Her temperature started coming down. 20 minutes later, she was stable. Olivia stepped back, pulling off her gloves. Voss stood near the door, watching her. When she walked past him into the hallway, he followed. You saved her life. Olivia didn't respond. You were right. I was wrong. I should have listened. She stopped, turned to face him. Yes, you should have. Voss took a breath. I need to know why you left the military. Olivia's jaw tightened. That's not your business. If you want to keep working here, it is. She stared at him for a long moment. Then she spoke, her voice quiet but edged with something raw. I left because I failed. Voss frowned. Failed how? Kandahar, 2013. My unit was ambushed during a patient evacuation. 4 critically wounded. I requested immediate extraction. Command denied it, said the area wasn't secure. Her hands clenched at her sides. I made the call to move anyway. We lost 2 patients in transit. The medical board blamed me for not following protocol. But you saved the other 2. That didn't matter, not to them. Voss was silent. Olivia turned away. I resigned before they could discharge me. Came here to start over, to practice medicine without the politics. She looked back at him. And now you know. Voss studied her, his expression unreadable. Then he nodded slowly. Okay. Okay? You're right. It's not my business. He paused. But your skills are, and this hospital needs them. Olivia didn't respond. Voss stepped closer. I'm offering you a position. Senior trauma surgeon. Full privileges. Olivia stared at him. You're serious? Completely. She shook her head. I'm a
second-year resident. No, you're not. Voss met her eyes. You're one of the best trauma surgeons I've ever seen, and I was an idiot not to recognize it sooner. Olivia looked away, her mind racing. I need time to think. Take it, but not too long. He walked away, leaving her standing alone in the hallway. And for the first time in 2 years, Olivia didn't know what to do next. Olivia stood in the hallway for a long time after Voss left. The offer hung in the air like a question she didn't know how to answer. Senior trauma surgeon, full privileges, everything she'd walked away from 2 years ago, handed back to her. But accepting it meant stepping out of the shadows. It meant owning who she'd been, who she still was, underneath the quiet deflections and the careful distance she kept from everyone. She wasn't sure she was ready for that. Her pager buzzed. Marcus was awake. Olivia took the stairs down to the military wing, moving quickly but not running. When she reached the recovery bay, Lieutenant Carla Wade was standing outside the door, arms crossed. Wade's expression was unreadable. "He's asking for you," Wade said. Olivia nodded and moved toward the door. Wade stepped into her path. "Before you go in there, I need to know something." Olivia stopped, waiting. Wade's eyes were sharp, assessing. Colonel Rains didn't just train anyone. He handpicked his surgical team, the best of the best. And there was one surgeon he trained who became a legend, a woman who held a field hospital alone for 11 hours during an ambush in Kandahar. Olivia's face gave nothing away. Wade continued. "Command tried to bury what happened, said she violated protocol. But the soldiers she saved, they told a different story. They said she refused to leave them behind, that she made a call command wouldn't make, and she kept them alive when anyone else would have let them die." Wade took a step closer. The Army erased her name from most of the records, but the people who were there, they remember. Olivia met her eyes, silent. "You're her," Wade said quietly. "Major Olivia Brennan." Olivia didn't confirm it. She didn't deny it. She just held Wade's gaze. Wade stepped aside. "He's lucky you were here." Olivia walked past her into the recovery bay. Marcus was propped up slightly, an oxygen cannula in his nose, his eyes half open. He looked exhausted, but he was alive. When he saw Olivia, his face shifted. Relief, recognition, something deeper. "Doc," he said, his voice rough, "they told me what you did." Olivia pulled a chair close to the bed and sat down. "How are you feeling?" "Like I got hit by a truck." He tried to smile, but it came out weak. "But I'm here because of you." "You're here because you're stubborn." Marcus laughed, then winced. "Yeah, that too." They sat in silence for a moment. Then Marcus spoke again, quieter this time. "Fallujah, 2011. I was 22, scared out of my mind. I thought I was going to die on that street." Olivia's hands rested in her lap, still. "You told me I was going to hold my daughter," Marcus continued. "You promised me, and I believed you. I don't know why, but I did." His eyes met hers. 2 weeks later, I was on a plane home. 3 weeks after that, my daughter was born. I held her in the hospital, and all I could think about was you, the doctor who kept me alive long enough to get there." Olivia's throat tightened, but she didn't let it show. "I tried to find you," Marcus said, "after I recovered. I wanted to thank you, but no one would tell me where you were. They said your records were classified, that you'd left the service." He paused. "Why'd you leave?" Olivia looked away, her gaze settling on the monitor beside the bed. Numbers moving steadily. Heart rate, oxygen saturation, blood pressure, all stable. "Because I made a call that got people killed," she said quietly. Marcus frowned. "What call?" "Kandahar. My unit was ambushed during an evac. Command refused extraction because the LZ wasn't secure. I moved the patients anyway. 2 of them died in transit." Marcus stared at her. "How many survived?" "2. "And if you'd stayed?" Olivia's jaw tightened. "All 4 would have died." "Then you made the right call." "The Army didn't think so." Marcus leaned forward slightly, wincing at the effort. "The Army's run by people who make decisions from behind desks. You were there. You saw what needed to happen. And you did it." Olivia met his eyes. "I've carried that day for 2 years," she said. "Every time I close my eyes, I see their faces, the ones who didn't make it." Marcus was silent for a moment. Then he reached out, his hand shaking slightly, and placed it over hers. "Doc, you saved my life twice now. Once in Fallujah, once today. I don't know what you're carrying, but I know this. You don't quit, you don't give up, and you sure as hell don't let people die if you can help it." His grip tightened. "So whatever the Army said, whatever that board decided, they were wrong. You hear me? They were wrong." Olivia's eyes burned, but she didn't let the tears fall. She just nodded. Marcus settled back against the pillow, exhausted. "My daughter's 12 now. Her name's Olivia."
Olivia blinked, surprised. Marcus smiled faintly. I told my wife about you, about the promise you made. She said if we ever had a girl, we'd name her after you. Olivia's breath caught. She wants to meet you, Marcus said, if that's okay. Olivia swallowed hard, her voice barely above a whisper. I'd like that. Marcus's eyes drifted closed. Good, because she's not going to believe her old man's story unless she hears it from you.
Olivia stayed until he fell asleep, then stood quietly and walked to the door. Wade was still outside, leaning against the wall. He's stable, Olivia said. Wade nodded. I heard what he said, about Kandahar. Olivia didn't respond. Wade pushed off the wall, her expression serious. For what it's worth, I read the after-action report, the classified one. Command knew the LZ was compromised. They knew extraction would take hours. You made the only call that gave those patients a chance. Olivia's hands clenched at her sides. The two who died would have died anyway, Wade interrupted, but the two who survived wouldn't have if you'd followed orders. She stepped closer. You didn't fail, Major. You were set up to fail, and you refused to accept it. Olivia stared at her, the words sinking in slowly. Wade handed her a card. If you ever want the full report, call me. I can get it unsealed. Olivia took the card, her fingers brushing the edges. Why? Because the people you saved deserve to have the truth told. Wade's voice softened, and so do you. Olivia looked down at the card, then slipped it into her pocket. Thank you. Wade nodded and walked away, leaving Olivia standing alone in the hallway. For the first time in 2 years, something inside her shifted. Not healing, not yet, but the beginning of it. She turned and headed back toward the main hospital. There were still patients to check on, still work to do. But as she walked, her steps felt lighter, less like running, more like moving forward. When she reached the residence lounge, Priya was waiting, 2 cups of coffee in hand. Thought you might need this, Priya said, holding one out. Olivia took it, grateful. They sat in silence for a moment. Then Priya spoke. So, Major Olivia Brennan, U.S. Army Medical Corps. Olivia glanced at her. You heard. Everyone heard. Priya took a sip of her coffee. You're kind of a big deal now. Olivia sighed. I didn't want to be a big deal. I wanted to be invisible. Too late for that. Olivia leaned back, closing her eyes. Voss offered me a position, senior trauma surgeon. Priya's eyes widened. Are you going to take it? I don't know. Why not? Olivia opened her eyes, staring at the ceiling. Because accepting it means I can't hide anymore. Priya set down her coffee. Good. Olivia looked at her. You shouldn't be hiding, Priya said firmly. You're one of the best surgeons I've ever seen, and this hospital needs you. Not the version of you that keeps her head down and deflects every question. The real you. Olivia didn't respond. Priya leaned forward. What are you so afraid of? Olivia's voice was quiet. That I'll make another call that gets someone killed. Priya was silent for a long moment. Then she said, You're going to make hard calls. That's what surgeons do. But hiding from them doesn't make you safer. It just makes you smaller. Olivia looked at her, something in Priya's words cutting through the walls she'd built. I'll think about it, Olivia said finally. Priya smiled. Good, because Voss is going to keep asking until you say yes. Olivia almost smiled. Almost. Her pager buzzed again. She glanced down. Dr. Voss, office, now. Olivia sighed, stood, and headed for the door. Priya called after her. Good luck. Olivia didn't answer. But as she walked toward Voss's office, she felt something she hadn't felt in a long time. Ready. Dr. Voss's office was exactly what Olivia expected. Neat, organized, diplomas on the wall, medical journals stacked precisely on the desk, everything in its place. He was standing by the window when she walked in, hands clasped behind his back. Close the door, he said, without turning. Olivia did. Voss turned to face her, his expression unreadable. Sit. She sat. He remained standing, studying her for a long moment. Then he moved to his desk, opened a file, and slid it across to her. Olivia looked down. It was her personnel file, thin, almost empty. 2 pages, Voss said. That's all the information we have on you. Medical degree from a civilian program, board scores, a few reference letters that say almost nothing, and a 2-year gap with no explanation.
He sat down, leaning forward. I made some calls today. Spoke to a friend at the Department of Defense. Asked about you. Olivia's face remained calm, but her pulse quickened. He wouldn't give me details, Voss continued. Said your service record is sealed, but he did tell me one thing. He paused. You were part of a special operations surgical team, the kind that gets deployed to places that don't officially exist. And you were decorated. 3 times. Olivia said nothing. Voss leaned back in his chair. He also told me about Kandahar, not the official version, the real one. Olivia's hands tightened in her lap. He said you held a field hospital under fire for 11 hours, alone, after your team was killed. You performed 17 surgeries, saved 14 lives, and refused extraction until every surviving patient was evacuated. Voss's voice softened. And then the army blamed you for the 2 who didn't make it. Olivia looked away. They said you violated protocol, Voss continued, that you moved patients without authorization. But my friend told me the truth. Command refused extraction because the area wasn't secure. They were willing to let all 4 die rather than risk a helicopter. He paused. You weren't reckless. You were the only one willing to make the call no one else would. Olivia's throat tightened, but she didn't speak. Voss stood, walked around the desk, and leaned against it.
Facing her, I owe you an apology, he said quietly. I judged you, dismissed you, assumed you were just another resident trying to get through the program. He met her eyes. I was wrong, and I'm sorry. Olivia looked up at him, surprised. I don't need an apology, she said. Yes, you do. Voss crossed his arms. And you also need to stop hiding. Olivia's jaw tightened. I'm not hiding. Yes, you are. You've been hiding since the day you got here, keeping your head down, deflecting questions, making yourself invisible. And I understand why, but it needs to stop. He moved back to his chair, sitting down. This hospital needs what you can do, not just your surgical skills, your instincts, your ability to see what others miss, your refusal to give up when everyone else has. He opened a drawer, pulled out a document, and slid it across the desk. This is a contract. Senior trauma surgeon, full attending privileges. You'll lead the trauma program, train residents, and have complete autonomy in the OR. Olivia stared at the document. There are conditions, Voss continued. You'll establish a trauma training initiative. Teach residents the techniques you learned in the field, combat medicine adapted for civilian use. It's something no other hospital in the region is doing. He leaned forward. You'll also mentor. Be visible. Be the surgeon I saw today, not the one who's been pretending to be less than she is. Olivia's hands hovered over the document, but she didn't touch it. I can't, she said quietly. Voss frowned. Why not? Because I don't trust myself. The words hung in the air. Voss was silent for a moment. Then he said, You saved 3 lives today. Marcus Tate, the woman in Thyroid Storm, and probably a dozen others I don't even know about. What part of that suggests you can't be trusted? Olivia looked down at her hands. I made a call in Kandahar that killed 2 people. No, you made a call that saved 2 people. The other 2 were already dying. You don't know that. Yes, I do. Voss's voice was firm. Because I've read the medical reports. Both patients had injuries incompatible with survival. Even if you'd stayed in place, they wouldn't have made it. Olivia's breath hitched. But the board. The board was wrong, Voss interrupted. They needed someone to blame, and you were the easiest target. But that doesn't make their decision true. He stood, walking to the window again. You're carrying guilt that isn't yours to carry, and it's stopping you from being the surgeon you're meant to be. Olivia stared at the contract, her mind racing. What if I make another mistake? She asked quietly. You will, Voss said simply. Every surgeon does. But the difference between a good surgeon and a great one isn't that they never make mistakes. It's that they don't let fear stop them from trying. He turned back to face her. You saved Marcus Tate today with a procedure most surgeons wouldn't even attempt. You diagnosed thyroid storm when I missed it. You performed a craniotomy in a field surgical bay with improvised equipment. He walked back to the desk. That's not luck. That's skill, experience, and courage. Olivia looked up at him, her eyes searching his face. I need time, she said. You have 24 hours.
Voss's tone was firm but not unkind. After that, I'm offering the position to someone else. Olivia stood slowly, the contract still on the desk. Okay. She turned toward the door. Brennan. She stopped, looking back. Voss's expression softened. For what it's worth, Colonel Rains would be proud of you. Olivia's breath caught. She nodded once, then walked out. The hallway was quiet. Most of the evening shift had ended, and the hospital had settled into its nighttime rhythm. Fewer people, less noise, just the steady hum of machines and the occasional distant alarm. Olivia walked slowly, her mind turning over everything Voss had said. She reached the chapel, a small room near the main lobby that was always open. She stepped inside, closed the door, and sat in the back row. The room was dim, lit only by a single lamp near the front. Peaceful. Olivia pulled the dog tag from beneath her scrubs, holding it in her hand. Colonel David Rains, her mentor, her friend, the man who taught her everything she knew about surgery, about leadership, about making impossible decisions under fire. He died covering their evacuation in Kandahar, took 3 rounds to the chest while pulling a wounded soldier into the transport. His last words to her had been simple. Do no harm means do something. Olivia had carried those words for 2 years, but she'd forgotten what they meant. She'd been so focused on the harm she'd caused, the mistakes she'd made, that she'd stopped seeing the lives she'd saved. Marcus Tate, his daughter, Olivia, the woman in Thyroid Storm, the 14 soldiers in Kandahar who'd made it home because she refused to give up. She closed her eyes, the dog tag cool against her palm. I don't know if I can do this, she whispered. No one answered. But in the silence, she felt something shift. Not certainty, not confidence, just the quiet, steady resolve that had kept her going through 11 hours under fire. The same resolve that had brought her here. She opened her eyes, slipped the dog tag beneath her scrubs, and stood. When she walked out of the chapel, her steps were steady. She knew what she was going to do. The next morning, Olivia walked into Voss's office and placed the signed contract on his desk. He looked up, surprised. You're sure? No, Olivia said honestly, but I'm doing
it anyway. Voss smiled. Good. He stood, extending his hand. Olivia shook it. Welcome to the team, Dr. Brennan. She nodded, then turned to leave. One more thing, Voss said. She stopped. There's someone here to see you. Recovery Bay, military wing. Olivia frowned. Who? You'll see. She headed down to the military wing, her curiosity piqued. When she reached the recovery bay, she stopped in the doorway. Marcus was sitting up in bed, looking stronger. Beside him stood a woman in her mid-30s, holding the hand of a young girl with dark hair and bright eyes. The girl looked up as Olivia entered. Are you Dr. Brennan? She asked. Olivia nodded slowly. The girl smiled. I'm Olivia. I'm named after you. Olivia's breath caught. Marcus's wife stepped forward, her eyes shining. Thank you for saving him, both times. Olivia didn't know what to say, so she just knelt down, meeting the girl's eyes. Your dad's a fighter, Olivia said softly. He didn't give up. That's why he's here. The girl nodded seriously. He told me about you. He said you made him a promise. I did. And you kept it. Olivia's throat tightened. Yes, I did. The girl threw her arms around Olivia's neck, hugging her tight. And for the first time in 2 years, Olivia let herself cry. 3 months later, Metropolitan General Hospital looked different to Olivia. Not physically. The same hallways, the same fluorescent lights, the same chaos of an urban trauma center. But her place in it had changed. She stood at the front of a simulation lab, 20 residents seated before her. Some looked eager, others skeptical. A few looked terrified. She understood all of those reactions. Combat medicine isn't about war, Olivia began, her voice steady and clear. It's about making decisions when there's no time, no backup, and no margin for error. It's about working with what you have instead of what you wish you had. She gestured to the mannequin on the table behind her. Today, we're going to practice needle cricothyrotomy. This procedure can save a life in under 60 seconds, but it requires precision, confidence, and the ability to act when everyone around you is panicking. One of the residents raised a hand, a young man, maybe 26, with nervous energy.
Dr. Brennan, how many times have you performed this in the field? Olivia met his eyes. 43 times. The room went silent. How many survived? Another resident asked. 41. The silence deepened. Olivia moved to the mannequin, her hands steady as she picked up the equipment. The two who didn't survive had injuries incompatible with life, but the procedure gave them a chance, and in trauma medicine, a chance is sometimes all you can offer. She demonstrated the technique, her movements fluid and precise, palpating the cricothyroid membrane, inserting the needle at a 45-degree angle, confirming placement, securing the airway. The residents watched, transfixed. "Now you try," Olivia said, stepping back. One by one, they approached the mannequin. Olivia corrected hand positions, adjusted angles, offered quiet encouragement. Priya stood in the doorway, watching with a smile. When the session ended, the residents filed out, buzzing with energy and questions. Priya walked over, arms crossed. "You're good at this," she said. Olivia stripped off her gloves. "It's strange. Teaching. Strange how? I spent 2 years trying to be invisible. Now I'm standing in front of 20 people, telling them stories I never wanted to tell." Priya tilted her head. "Do you regret it?" Olivia paused, considering. "No, but it's not easy. The best things never are." Olivia smiled faintly. "You sound like my old CO. I'll take that as a compliment." They walked together toward the trauma bay, where the afternoon shift was beginning. Olivia had started splitting her time between surgery and teaching, and the balance felt right. Challenging, but right. Her pager buzzed. Incoming trauma. MVA, multiple casualties. Olivia moved immediately, her body shifting into the rhythm she knew by heart. Priya fell in beside her, and together they pushed through the doors into organized chaos. 2 gurneys arrived simultaneously, a woman in her 50s with blunt chest trauma, a teenage boy with a head injury. Olivia assessed the woman first. Flail chest, probable pulmonary contusion. She rattled off orders, her voice calm and commanding. The team moved around her without hesitation now. They'd learned to trust her instincts, her decisions. She stabilized the woman, then moved to the boy. Priya was already managing his airway, but his pupils were unequal. "Possible epidural hematoma," Olivia said. "Get me a CT, stat, and call neurosurgery." The boy's mother stood nearby, her face pale, hands shaking. Olivia stepped toward her, pulling off her gloves. "He's going to be okay," Olivia said quietly. "We're taking good care of him." The mother's eyes filled with tears. "Are you sure?" Olivia placed a hand on her shoulder. "I can't make promises, but I can tell you that he's getting the best care possible, and we're not giving up." The mother nodded, clutching Olivia's hand briefly before letting go. Olivia returned to the trauma bay, where the organized chaos continued. She moved between patients, coordinating care, making calls, her mind sharp and focused. This was what she was meant to do. Not hide, not second guess, just act. Later that evening, Olivia stood in her office, reviewing charts. The space was small, but functional. A desk, a computer, a few books on the shelf, and on the wall, a framed photograph. One from Kandahar. Her team, exhausted and bloodied, holding up mugs of cold coffee. Colonel Rains in the center, smiling. Olivia stared at it for a long moment. Then her phone buzzed. A text from Marcus. "Olivia's school play is next week. We'd love for you to come." Olivia smiled, typing a quick response. "I'll be there." She set the phone down and returned to the charts. A knock at the door. "Come in." Dr. Voss stepped inside, holding a folder. "I wanted to show you something," he said, setting the folder on her desk. Olivia opened it. Applications, dozens of them. "Residency applications," Voss explained, "for next year. We've received 3 times the usual number, and almost all of them mention your trauma program." Olivia looked up, surprised. "Word's spreading," Voss continued, "about what you're teaching here, about the techniques, the approach. Other hospitals are asking questions, wanting to implement similar programs." He smiled. "You're changing things, Brennan." Olivia looked down at the applications, her chest tightening with something she couldn't quite name. Pride, maybe? Or purpose? "There's something else," Voss said. He pulled out another document. The Department of Defense reached out. They want you to consult on a new training curriculum for combat medics, civilian trauma techniques adapted for field use. Olivia's breath caught. They want me to work with the military again? Not work for them, work with them, on your terms. He set the document on the desk. It's your choice, but I think Colonel Rains would want you to consider it. Olivia stared at the document, her mind racing. Voss headed for the door, then paused. For what it's worth, I'm glad you stayed. So am I, Olivia said quietly. Voss nodded and left. Olivia sat alone in her office, the photograph on the wall catching her eye again. She stood, walked over to it, and touched the frame lightly. I'm still here, she whispered, still doing the work. She picked up her phone and dialed a number she hadn't called in 2 years. Lieutenant Carla Wade answered on the second ring. Major Brennan. Just Olivia now. Wade's voice softened. What can I do for you? That report you mentioned, the one from Kandahar, I'd like to see it. There was a pause. I'll have it sent over, Wade said. It's time you knew the whole truth. Thank you. Olivia? Yeah? Welcome back. Olivia hung up, her hands steady, her breathing calm. She returned to her desk and opened the DoD document, read it carefully. Then she picked up a pen and signed her name. 1 week later, Olivia sat in a crowded elementary school auditorium, squeezed between Marcus and his wife. On stage, a group of 12-year-olds performed a play about courage and perseverance. Young Olivia played a doctor, her lines delivered with surprising confidence. Marcus leaned over, whispering. She practiced that speech 100 times, wanted it to be perfect. Olivia smiled. She's doing great. When the play ended, the audience erupted in applause. Young Olivia took her bow, her face glowing with pride. Afterward, she ran straight to Olivia, hugging her tightly. Did you like it? I loved it, Olivia said, kneeling down. You were incredible. The girl beamed. I want to be a doctor, like you. Olivia's throat tightened. Then you will be. Marcus placed a hand on Olivia's shoulder. Thank you for everything. Olivia looked up at him, then at his wife and daughter. This was why she did it. Not for the recognition, not for the title, for this, for the lives that continued, for the promises kept. That night, Olivia returned to her apartment, small, neat, quiet. She sat on the couch, pulling out the report Wade had sent, the full account of Kandahar. She read it slowly, carefully. The truth was there, in black and white. Command had known the LZ was compromised. They'd made the call to delay extraction, knowing it would likely result in casualties. Olivia had defied orders, moved the patients anyway, and saved 2 lives. The board had blamed her, not because she was wrong, but because she'd made command look incompetent. Olivia set the report down, her hands shaking slightly, not from fear, from release. She'd been carrying guilt for something that was never her fault. She closed her eyes, exhaling slowly. Then she picked up the dog tag, holding it in her palm. I kept the promise, Colonel, she whispered. I'm still keeping it. She placed the dog tag on the table beside the report. Then she stood, walked to her desk, and opened her laptop. A new email waited. From the Department of Defense. Dr. Brennan, we're honored to have you as a consultant. Your first training session is scheduled for next month. We look forward to learning from you. Olivia read it twice. Then she closed the laptop and looked out the window. The city lights stretched out before her, endless and alive. She'd spent 2 years hiding in those lights. Now she was stepping back into them. Not as Major Brennan, not as the invisible resident, as herself, flawed, scarred, still learning, but no longer afraid. Her phone buzzed. A text from Priya. Trauma incoming. You available? Olivia smiled, grabbed her jacket, and headed for the door. She was exactly where she was meant to be, and she wasn't running anymore. Subscribe to Emergency Hero Stories for more true tales of courage, competence, and the quiet strength that saves lives. Comment below and tell us, what would you do if you had to choose between following orders and saving a life? Because sometimes the right choice is the hardest one to make.